Hi, good morning Felicia. My name is Frederick Marco. I'm your invigilator for the OET speaking session on the 17th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Felicia Charlotte.
And what is your candidate number, please?
My candidate number is 201301442.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you create a rapport with other nurses and doctors?
I love working on a team with a sense of purpose. Being part of any healthcare team has always given me true meaning and incentive. I try to remain selfless, flexible, and dependable. When a fellow nurse once asked me to look after her patient for an hour, while she attended to a personal emergency, I ran over to the hospitalist to get briefed on the patient, and I was able to care for the patient, in addition to the other 2 patients under my care. Of course, the team was very grateful, and I knew they'd do the same for me.
Where do you see yourself in 5 years?
I'm always worked to become one of the most productive nurses on the team. I want to be indispensable. And eventually, I'd love to raise my status to a nursing team leader, and even help with training. But before that, my plan is to obtain my Master of Science in Nursing, so that I can become an advanced practice registered nurse. My dream is to be able to go deeper with patients, by evaluating their test results, helping doctors with diagnoses, and referring them to specialists.
What makes a shift satisfying to you?
At the end of a long shift, I feel really fulfilled when I see how my team has effectively followed all safety procedures, using the proper documentation, how we supported each other throughout some grueling hours, and how we all displayed enough resilience to get up again and conquer another workday.
Do you work well under pressure?
By nature, I'm very even-tempered, and that has given me strong foundational protection against stress. I also practice mindfulness and meditation daily, which has helped to further strengthen my mind. Additionally, I'm a runner, and I've found that jogging a few miles every weekend always helps me to clear my head and brace myself for the coming work week. And recently, I attended a symposium on workplace stress, which taught me about stress reduction techniques, such as taking walks during my lunch breaks to avoid burnout.
How do you deal with a particularly demanding patient?
I stay focused on the patient's needs, and I do my best to not take any disparagement personally. I understand that a patient's attitudes may be colored by whatever pain or condition is afflicting them. During my last job as an RN at a continuously busy hospital, I faced many difficult patients. It came with the territory. But I realized that most of them were not being difficult just for the sake of being difficult. If you treat them with respect, sitting down to speak with them, taking the time to listen carefully to their needs, despite your tight schedule, you will be able to find a solution.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello, good evening. My name is Felicia, and I am one of the nurses in the emergency department. How may I help you?
I want the doctor to attend to my friend immediately.
I acknowledge your concern about your friend. Well, before proceeding further, how may I address you?
You can call me Frederick.
Thank you. Frederick, may I ask you some questions about the details, please?
Yes, sure. Go ahead.
Could you please explain to me what has happened to your friend?
Sure. Well, me and my mate were having a game of touch football. My mate fell and seems to have broken his arm.
Thank you for your explanation. Is the patient drunk?
Yes, nurse.
All right. A triage nurse has reviewed your friend, and he will be consulted as soon as possible.
Nurse, it is our turn to get a consultation. Others who came after us have been seen.
I can understand your concern. Kindly, listen to me. I will explain why it is so.
What should I listen to?
Frederick, in the emergency department, the patients are seen in the order of medical priority, not by the arrival time. A triage nurse has already reviewed your friend's condition, and he will be seen as per the priority.
He pays tax, and he has a right to be seen without any delay.
Your thoughts are sensible. Nevertheless, his rights will be protected, and he will be seen by the doctor when his turn comes.
That's what I told you. This is his turn.
Please, Frederick, kindly calm down. I would like to bring to your attention that you are disturbing other patients.
What do you mean?
Kindly consider that every patient and their bystanders will be upset in a hospital facility, especially in the emergency department. Please calm down.
All right. My friend is in pain. What can you say about that?
Your question is reasonable. Since your friend has drunk alcohol, pain medication is not possible. It will be having an adverse effect on him.
Oh. Is that so? Then, let me give him some drink. And that will make him sedate, and help him to get rid of the pain.
Excuse me, please. For your information, Frederick, alcohol consumption, or intoxication, is not permitted on the hospital premises.
You people are not considering my friend suffering from pain. What can I do? Tell me, nurse.
I have already explained you the same. Frederick, we will take care of your friend. Kindly, you may please wait outside the department, or you can go home. Don't worry, Frederick, I can assure you that your friend will be taken care of by us.
If I leave him here, how will he reach home?
Don't worry, Frederick, we will make arrangements for your friend to get home safely.
I don't want to hear anything. Nurse, if you don't act now, I'll make trouble.
Frederick, I am really sorry to say, but in cases of threatening behavior, I will inform the hospital security staff, and they will be taking action, as per the policies.
Oh really? Are you threatening me now?
Absolutely no, Frederick. I said it, for your information. Kindly cooperates with us. I can assure you that your friend will be seen very shortly as per his priority. Thank you.
All right. Anyway, I can wait for some more time, and we'll see then.
Great. Thank you for listening to me, Frederick. I hope I am clear to you.
Yes. I got it.
Thank you for your cooperation and understanding. I assure you that your friend will be seen very soon.
Okay. That is the end of your OET speaking roleplay. All the best.
Thank you. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.